Hi everyone, welcome back to Nursing Lecture Room. Your go-to channel for health nursing education. So today we are we are debunking some of the most common pregnancy myths and setting records straight with real fact. Whether you are an expecting mom, whether you are a healthcare student, or you are just curious person, this video is for you. Let's separate the fact from fiction and support healthy, informed pregnancies. Let's get started. So, I know you have heard people talking about so many myths about pregnancy. Some of them are true, some of them are untrue. And today we're going to separate the myths and the facts. The myths about some of the pregnancies and the fact about those things. So number one, we have 10 points. And you're free to add any myth that you've ever heard somebody talking about pregnancy. Put it in the comment section so that we will learn about those myths and get to know the facts. Yeah. So number one myth: you can't get pregnant when you are breastfeeding. Yo, my dear, you can get pregnant when you are breastfeeding, so long as your monthly period has returned and you are 6 months, you are more than 6 months breastfeeding, your monthly period has returned, my dear, you can get pregnant. Breastfeeding is one of the natural family planning method, but it has condition. You must be exclusive breastfeeding and your monthly period has not returned. Remember, some women just get back to their fertility phase immediately after giving birth. So let you not be cheated. You can get pregnant when you are breastfeeding. Number two, you are eating for two. My dear, you only need a few hundred of extra calories per day during pregnancy, especially in the second and third trimesters. Overeating can lead to complications. You can get big baby, you can be overweight, and if you're overweight, you are at risk of getting so many pregnancy complications. So you are not eating for two. You only need a few extra calories. So maybe eat healthy. Don't eat. Make sure you eat a balanced diet. Focus mostly on protein, vitamins. Yeah. Don't overeat. Don't eat quantity. Eat quality. Number three, morning sickness only happen in the morning. My dear, that thing can affect your days and nights. It is only not. That is just assumption. It is a myth. It is. I don't know who gave that thing morning the name morning sickness, because you can be sick the whole day, the whole night. So it doesn't apply there. Yeah. Number four, you can't dye your hair during pregnancy. Most research shows that hair dye is safe and it is moderate, especially after the first trimester. So always consult with the doctor to know when you are when you can dye your hair. If you're someone who usually dye the hair, or if you're someone who like dyeing the hair, yeah, consult with your healthcare provider. Heartburn means the baby will have a lot of hair. Wrong. It is a myth. There is nothing like that. Heartburn, there is no scientific evidence for this myth, and those some small studies found weak correlation, but mostly heartburn is caused by the hormones, the influctuation of the hormones in the body, not that the baby will have a lot of hair. That is wrong. It is a myth. Number six, you shouldn't do exercise while pregnant. My dear, it is safe to do exercise while pregnant unless the doctor instructed you. You are a pregnant woman who is at risk of getting complication, is when you can focus on total bed rest. But walking, swimming, yoga exercise, yeah, those are some of the exercises that you can do. Another thing that also these people, another myth is that you should not take any medication at all when you are pregnant. Remember, we usually take iron folic acid, which prevent fetal malformation, and also they help you with the prevention of anemia. And yeah, so it doesn't make sense if you say that you should not take any medication at all. And also remember, sometimes when you are pregnant, you can get some complications. You will be put, not even complication, you can get sick and you will be put in medication. Yeah, so that is a myth. No evidence for that myth. So you can tell, another myth is that you can tell gender by the shape of the belly. The shape of the belly depends on the position of the baby. Yeah, my dear, the shape of your belly when you are pregnant depends on the position of the baby, not the gender of the baby. There is no evidence about that. Number 9, Spicy food causes premature labor. There is no evidence that spicy food trigger labor. They may cause heartburn, but early delivery, there is no evidence of all that. Yeah. So those are some of the myths that myths and misconception. I think I've exhausted them. Yeah. Another myth that is also very important is that you cannot do exercise when you cannot do sex when you are pregnant. Sex is safe when you are pregnant unless the doctor instructed you that you should avoid it. Especially most people who usually get that instruction from the doctor is those who are at risk of losing the pregnancy. Maybe they have threatened abortion, yeah, or maybe they had incomplete abortion, or they have previous abortion. They have ever had previous abortion. So the doctor will instruct them to stay safe until the baby is born, because the doctor cannot allow you to, cannot make you, or cannot allow you to be at risk. So those are the time when you will be told to abstain until you deliver. Not until then. Sex is safe during pregnancy, very safe, and it is advisable because it is also part of exercise, right? Yeah. So long as the woman is comfortable, then you can go and do it. Yeah, those are some of the myths that people usually assume that are true. So I think I've shed light on that. So in case you're having another myth, yeah, in case you're having another myth, write it there in the comment section so that we learn and we shed light on that myth. Yeah. So bye till next time. Let's meet in the next video. Bye.